Hello everyone, in this video we are going to discuss about respiratory membrane physiology. So what is this respiratory membrane? It is a very thin barrier that separates the alveolar air from the pulmonary capillary blood, and it is the site for gas exchange in the lungs. So there are 5 layers of this respiratory membrane. The first and foremost layer is the alveolar epithelium. It is mainly made up of type 1 pneumocytes. Around 95% of this constitutes the alveolar epithelium. These are thin and very flat. This will help in easy exchange of the gases. Next layer is epithelial basement membrane, and the third one is the interstitial space. It consists of fluid and elastin and collagen. And the fourth layer is the capillary basement membrane, and the fifth layer is the capillary endothelium. These are the 5 layers of the respiratory membrane. Sometimes this capillary basement membrane and the epithelial basement membrane can be fused. So it have alveolar epithelium and epithelial basement membrane. Middle one is the interstitial space, and the capillary basement membrane and the capillary endothelium. So what are the gases involved in this mechanism of exchange? The two gases are oxygen and the carbon dioxide. So we know the oxygen will be moved from the alveolar air through the respiratory membrane into the blood, and it will bind to the hemoglobin and it will be carried to the tissues. And carbon dioxide moves from the blood into the through this membrane into the alveolar air to be exhaled. So why this gas exchange occurs? This occurs because of the passive diffusion, because of the partial pressure gradients. Oxygen pressure in the alveoli is around 100 millimeters of mercury compared to the blood, which is 40 millimeters of mercury. So it is very high in the alveoli. We know according to the pressure gradient, gases move from high pressure to low pressure area. So there will be movement of the oxygen from the alveoli into the blood. In reverse, carbon dioxide, the partial pressure in the blood is 45 compared to the alveoli, which is 40. So it moves from the blood into the alveoli. So coming to the fixed law of diffusion, gas diffusion across the membrane is described as fixed law. The rate of diffusion according to this equation is surface area into diffusion coefficient multiplied by partial pressure difference by the thickness of membrane. So it is inversely related to the thickness of membrane and directly related to the surface area, and also diffusion coefficient and also partial pressure difference. So let us see a case scenario based on this. A 60-year-old woman with interstitial lung disease presents with exertional dyspnea. Her surface area is 70 meters square, and due to fibrosis, thickness has been increased from 0.5 microns to 1.5 micrometers. And the oxygen gradient they have given is 60 millimeters of mercury, and diffusion coefficient given is 1. So the rate of diffusion will be in the normal situation it is 0.5 microns. So we will take this 70 into 1 into partial pressure gradient 60 by 0.5 microns. In meters is 0.5 into 10 power minus 6 meters. It will come to 8.4 into 10 power 9 units. If we give the increased thickness, that is 1.5 microns, that will be summing up to 2.8 into 10 power 9 units. So we can see there is decrease in the diffusion because of this increase in the thickness. So factors affecting the gas exchange, as we already saw, according to this law, it is inversely related to the thickness. So if there is increase in the membrane thickness, there is decrease in the diffusion. If there is decrease in the surface area, there is decrease in the diffusion, because it is directly related. This decrease in the surface area can be seen in conditions like emphysema, which destroys the alveolar walls. Decrease in the partial pressure gradient and increase in the diffusion space also causes decrease in the gas exchange. And capillary perfusion also affects this. If there is no optimum perfusion, this exchange will be decreased. Next, clinical significance. In pulmonary edema and also fibrosis, there will be fluid and collagen deposition. In fibrosis, there is collagen deposition. In pulmonary edema, there is fluid deposition in the interstitium, which is the third layer of the respiratory membrane. So because of this deposition, there is increase in the thickness, which causes decrease in the oxygen diffusion. Next, in emphysema, we can see alveolar wall destruction, which causes decrease in the surface area and causes decrease in the gas exchange. And pulmonary embolism, there is blocked blood flow. Because of this, perfusion is decreased, causing ventilation perfusion mismatch, causing decrease in the oxygen delivery. Next is ARDS. Here there is inflammation along with the capillary leakage, causing increase in the thickness and decrease in the oxygen and the carbon dioxide exchange.